Good afternoon, everyone. I'm Sayukta from beautiful Spotless Skin team. I'm sure all of you must be keeping good health. To look beautiful and smart at all times is quest of humans right from the beginning of civilization. You all know proper skin protection is the best thing you can do for the health of your skin today and slow down the effects of aging tomorrow. In today's era, changing weather with excessive heat or humidity increases risk of damage due to UV rays, which makes skins more prone to wrinkles, melasma, and skin cancer. We know that sunscreen is valuable from a skin cancer and sun damage perspective, as well as something that helps prevent fine lines and wrinkles. According to a survey, 67% of people in India are not yet using sunscreen as a daily skincare routine. Several things about sunscreen that we are not aware of, and that makes us not to include sunscreen as an integral part of skincare routine. So to keep us informed, today we are here to know more about sunscreen in our daily skincare regimen. Premature aging is no different. Proper skincare routine, which majorly includes sunscreen, will help in preventing premature aging. So let's connect today with our skin expert, Dr. Chanchal Choudhary from Noida on the topic of sunscreen in premature aging. Dr. Chanchal Choudhary has an experience of more than 18 years with in-depth knowledge of medical dermatology, dermatological surgery, cosmetic dermatology, and hair transplant. She did her post-graduation from Dr. D.Y. Patil Medical College, Pune, senior residency in P.N. Behal Skin Institute. A very warm welcome to you, Dr. Chanchal. Hope you're doing good.
Yeah, thank you. Thank you very much. Yeah, I am very good.
So, Doctor, today we are going to talk about the importance of sunscreen and how it can actually delay premature aging. Now, first of all, we would like to understand, Doctor, because we all know that, sunscreen is essential. That's okay. But then we really don't understand why should we wear sunscreen every day. I'm sure you also get patients who ask the same question. Why is there a need of wearing sunscreen each and every day? Please shed some light over that, Doctor.
Of course, of course. See, we all aware of sunlight. But if we deeply look into sunlight, we can divide sunlight into visible lights and UV lights. Okay. And there is infrared light. So infrared light is not visible to us. It just gives the warmth. Okay. That sunlight gives that warmth. Then comes the visible light, which we see is a daylight. And then the UV light, which is again not visible to our eye. And these UV light are actually absorbed in our skin. And as we must be aware of UVA and UVB, so it's been divided into, and accordingly, the sunscreen protection factor also comes. So basically, we're protecting our skin from the absorption of these UV lights, which have some of the side effects of creating premature aging, as you already spoken about.
Right. So it's important to wear sunscreen regularly. But then, people wonder that, see, there is no sun outside, or my exposure under the sun is very, very minimum. I'm mostly working from home or the office where the atmosphere is air conditioned, and school, no trace of sun, not at all. Still, but to wear sunscreen regularly.
Yes, yes, that's an important point. As I mentioned, visible light, Now, visible light are even available, whatever LEDs we are using, the LCDs, and the blue light is what is being said, being reflected from the computers or your mobiles. And those light wavelengths also can be absorbed by your skin and give rise to different type of skin premature aging or pigmentation. Or sometimes even your skin immune system goes down. If there's a more of the absorption of these lights, then your skin immune system goes down, then you face a lot of skin problems. So this is the main factor. If you're not exposing yourself to the sunlight, even if you're driving, the sun from the windows, if you're sitting in a house where the sunlight is coming from the window of the house, even if the timing is between in the afternoon, when we say between 11 to 4, it's going to reflect, in any ways from the mirror or from your object, and your skin going to absorb that. And that light, which has UV, light, which is not visible to us, can create a problem.
Right. So no one of us lives in pitch darkness. So definitely our exposure to sun or the sun rays or the harmful radiations emitted by sun is there. Thus, we need to wear sunscreen regularly. Now, whenever we go out to buy a sunscreen for us, doctor, there is a term called SPF with a number of numbers, associated with it from 15, 20, 30, 40, 50. And we are really confused how to decide upon the SPF. Please elaborate what SPF level mean and why we should know about it while choosing sunscreen.
Yeah, so it's very common these days. People say, doctor, I'm using SPF 50, but still I have a problem. So what could be the reason? So now we should understand what is SPF. So SPF is sun protection factor. So when I talk about sun protection factor, if there's a study where we expose the sun without sunscreen and then we expose the sun with the sunscreen. So we take the time when we expose the skin with the sun with sunscreen on, how much time it will take actually it will take to give any sort of side effects. Okay, for example, if skin is exposed for 10 minutes without sunscreen and then you see the sunburn is happening, but if you've applied the sunscreen of SPF 15, okay, then it might take 150 minutes to give the same side effect. So then it's become SPF 15. So how we calculate like how much time we can actually save our skin from the exposure of a sun when we are wearing a certain amount of SPF. So it has been said that if you are wearing a sun protection factor 15, almost 94% of your ultraviolet rays has been taken care of, okay, by the sunscreen. But if we increase it to SPF 30, then it becomes 97. And if it becomes SPF 50, then it's almost 99% that it will be taken care by the sunscreen. So how it matters from 15 to 50 if you're changing your SPF factor.
Right. And how much quantity of sunscreen we need to apply, and also reapplication, we know is equally important. So how often we need to reapply?
Practically, theoretically, if you ask me, they said 2 milligram per centimeter square. It's very difficult to
Okay.
evaluate. But to really understand, make the patient, we always say take a tip of a finger and, this upper index finger and you just make a drop on your face, should cover your whole face. Okay. This is for the face. If you're taking a neck, you have to take this till this. Tip the second finger. But if you're covering the larger area, then we ask them to apply more than one fingertip, okay, for each area. So I usually explain my patient. This is the easy way them to understand that.
Right.
Normally what they do, they just do little, and they think they have applied it. But you need actually a good amount of sunscreen to take care of the sun protection.
So we need to cover our face or whatever body part is exposed. So we need to cover that, have a thin layer of sunscreen, so that much quantity is required. And how often to reapply, doctor?
Yes, so there are different sunscreen now. There's something broad spectrum sunscreen now, which we are available. So they really help for 6 hours to sometimes at 6 to 8 hours variations are there if you're actually using a broad spectrum sunscreen. When I mean to broad spectrum sunscreen, that means it has both the chemical sunscreen and the physical sunscreen in it. And being a broad spectrum, then you get a longer protection. And if you're using SPF 50, then better again, more than 99% of sun protection is there. So normally I ask patient to repeat it every 6 hours.
Okay. And you just mentioned physical and chemical sunscreens. So would you like to elaborate them a bit for us?
Yes. So sunscreen are divided into chemical and physical sunscreen. So when it's chemical sunscreen, they actually absorbs your UV rays, okay, and give a protection to the skin. Whereas when talking about the physical sunscreen, it has mainly said that it reflects the UV rays back. But it also now there's a little change also that after some rays, they also absorb a little bit. Absorption is also there, but basically chemical sunscreen absorbs the UV rays and physical sunscreen will reflect the UV rays. So physical sunscreen are considered a little more stable and inert and ideal sunscreen because they don't been absorbed in the skin. So they're considered a better inert and ideal way to go for.
Right. We all know, doctor, that how excessive heat, humidity, sun, these rays UVA, UVB are harmful for our skin, and we know that sunscreen is really essential. But still, 67% of Indians are not yet using sunscreen as a daily skincare regimen. Now they have, all kinds of complaints or excuses to not use sunscreen on a regular basis, like sunscreen make me very oily or patchy, or my skin becomes very dull after sunscreen, or I sweat a lot, or my acne just aggravates after applying a sunscreen. So how do you address? I'm sure you get people with same kind of complaints. So how do you address
Sooner the humid season comes, patients say, Doctor, I don't want to use it. And especially when it's an acne prone skin. So for
them?
acne prone skin, now we have special sunscreen, which been used for acne prone skin, and they are gel based or they are matte finish, so that, or they are water based, so they don't make your skin sticky, but still they protect your skin from sun. So this is the variations of different what type of lotion, gel, or matte finish we are using. According to skin type, we decide which sunscreen will be suitable to your skin. When we talk about sweat, so there are now available certain sweat resistant sunscreen, or what we can say water resistant sunscreen. So if you are wearing a sunscreen and if you're swimming, or then also to certain hours that your skin can be protected with the sunscreen on, even if known as water resistant sunscreens.
Right. And is there any different sunscreen available for premature aging? And doctor, we would also like to understand what is premature aging.
Now, when we talk about premature aging, it means that the elastin or the at the dermis level,
Mhm.
the or fibroblast or the collagen is degrading much faster than supposed to be. Why?
Mhm.
Because since we are talking about sunscreen, UVB, when we talk about UVB, it has the wavelength which is usually gives sunburn. Okay. And whereas UVA, it penetrates deeply to the dermis, where actually these cells which I've spoken about, like
Mhm.
fibroblasts, collagens, elastins, are there, and it leads to the degradation of these cells faster. Okay, so more the sun exposure, more the degradation of these cells, and sooner with the premature aging. We're supposed to be the chronological aging later after 40, 50, 60, but we start using because of more sun exposure, we still in early age, so known as premature age.
Right. So which age group is often considered in premature aging? I mean, as you said, 50, 60 के बाद अगर हो रहा है, that's not premature aging का अपना एक process है. But अगर वो पहले हो रहा है तो of course वो
I think
premature aging
mostly
है.
I tell it after 25 because start seeing the pigmentation, that fine lines or wrinkles started happening. So then it's considered as known as photo aging, basically
Right.
photo aging, and then it's being considered as a premature aging.
As you just mentioned the term photo, aging, we are these days so much exposed to screens, various kind of lights, infrared lights, or so many kinds of radiation. We are in front of either a laptop or a mobile screen or a tablet screen. Now, are the rays equally harmful?
Yes, of course, they are equally harmful, and we were not aware of it before.
Mm.
But even after COVID, more the exposure of these laptops and online. Now, recently, now it's been showing that they are more harmful. They're equally harmful, in fact. Okay,
Mhm.
so people do ask me, Doctor, I'm actually doing work from home, so why should I wear a sunscreen? So this is what I tell them that if you are there for hours, for 8 to 12 hours in front of a laptop, that means you're exposing similarly the one who is exposing himself outside. So wearing the sunscreen is very important. Where even when you are indoor nowadays, even these LCD, LED lights that we're using,
Mhm.
they are also very harmful. So they
So,
emit rays.
right, as we said in the beginning, that none of us is living in pitch dark. We
Yeah.
are under some source of light, and thus we are getting affected by the rays emitted by those light sources. Doctor, we would also like to understand that when should we start using sunscreen? What is the right age, and can children be put on sunscreens?
Yes, children I usually do if they have a lot of sports activity they do, you know. I usually tell them to apply sunscreen at that time, and then obviously after 18 or after, in fact, I should say, 14, 15 years after that, I usually make them use it regular because
Yeah.
we are going out more and exposing.
Mhm.
So this is how I usually start after 14, 15 as a regular,
Right.
routine for.
And this is also the time when, especially because we are talking about teens, they spend a lot of time with screens or outside as well. So yeah, they need to start using sunscreen right from their 40s or 14 or 15 when they are 14 or 15. Doctor, there are so many formulations available. You also said that if you have acne prone skin or oily skin, then gel based sunscreen is the best way out. Now we have spray, we have cream, we have gel, we have lotions. So how to choose the suitable sunscreen formulation as per our individual skin?
Yeah, so as I said, there are different type of sunscreen. Some are photostable, and some are not stable. Okay, so nowadays the sunscreen which are being made, which are available in the market, as I said, they are growth factors. Okay, so they have kept the sunscreen. If I spoke about amino benzones are there, or amobenzones, or insulate are there, or if I talk about physical sunscreen, then titanium oxide or zinc oxides. And so there are other factors also which we see. So their sunscreens are made stabilized. Now, whatever sunscreen are made, they are made stabilized in a stabilized form they come, and then the formulation are made according to your skin type, like lotion, as I said, lotion, gel, spray you mentioned also, and matte finish, silicone based. Okay. And so this is all the formulation which is available. And along with nowadays, what is happening is some anti-aging factors also been added in the sunscreen,
Right.
or anti-pigmentary factors are also available now with the sunscreen. So you don't
Mhm.
need to apply the extra serums. They are already inbuilt in the sunscreen. So that is really helpful. And some sunscreen are which are coming a tinted sunscreen. Yeah. So those tinted sunscreen are again very useful when we talk about the pigmentation or we are doing some procedures. So they really give that extra protection, and also it gives a little that little foundation effect as well to the patient. So patients sometimes they really like it.
Right. So the best way is to go and consult a dermatologist because they'll know what is your skin type. They can advise you the right, formulation or sunscreen. And of course, doctor, there are medicated sunscreens. There are, on the over the counter available or the cosmetic brand of sunscreens. So, which is the best kind of sunscreen to go for?
So online which is available, so I don't prefer my patient to use them because sometimes I have seen the patient which are coming to me, they have some aggravation of their acne or their pigmentation because something or the other ingredient in that has that they're just not mentioned what has been been already there. So I usually tell my patient to use the one which has been prescribed by a dermatologist, and then once you know what is the best for you, you can then proceed for it for the availability of that sunscreen.
Right. And okay, I'll take one of the questions that our viewer has asked. Aradhana Soni is saying, ma'am, what's the best way to handle sensitive skin? And with that, we would also like to know about the best suited sunscreen for a sensitive skin.
Yeah, so I don't name any particular brand as
Hmm.
such, but when we talk about sensitive skin, and there are sunscreen which are available for the sensitive skin, which has ingredient which is basically meant to take care of your UV protection as well as the sensitiveness. Okay, and so that is where how we decide that sunscreen is available. So you need to see a doctor for that,
Hmm.
and so that is there. And there are some where like chemicals which actually gives a moisturizer, but it takes care of your humid level. Okay, so when we talk about sensitive, that means you have a either transepidermal water loss excessive, or you're not able to repair it. Okay,
Hmm.
or your skin reacts to the any sort of react allergens. So we just take care of that. We'll ask the patient accordingly. We tell them how to decide for the sensitive skin.
Okay. So Aradhana, you need to go and visit dermatologist for this. Rajat Saxena is asking how to deal with dry skin that's peeling and is sunburned.
Yeah. So when we talk about sunburn, so when it's peeling off, then we give a medication. So that, as I said, when there's a sunburn, that means your skin has reacted. There's an inflammation in your skin. So we have to take care of that inflammation, which has happened because of sunburn. Along with, we give a soothing cream, okay, which has a repairing cream, plus, of course, the sunscreen application. So this is how we take care of the sunburn and followed by the repair, whatever's happened because of the sunburn.
Right. Namrata Mehra is asking, okay, we already spoke about it. Is a high number SPF better than a low number?
Yes, of course. As I mentioned, yes, it has been said. As I said, SPF 30 and SPF 50, so there's just a difference of 3 to 4%. Okay, so people do ask me, doctor, I'm using SPF 30, will it be okay? I will say yes. If you're not having too much of an outdoor activities, then wearing SPF 30 also, it's okay if it suits to you. But if you're doing some cosmetic treatment or some sort of treatment, I usually prefer doing SPF 50 for better the protection, because your skin should be better protected. What treatment we are doing, should give the results. So SPF 50.
Right. Again, Namrata, you can just go and check with your doctor, your dermatologist in this case, because they'll know your skin better. They'll know, which formulation, what SPF will suit you best as per your skin type or your, activities. Okay, Akansha Jan is asking a very common people question that if I wear sunscreen often, can I get a vitamin D deficiency?
Yeah, so this is a myth. No, not at all. See, because when what we say, you wear your sunscreen at 10 o'clock, okay, or 9 o'clock. The sunscreen, the sun exposure, if you do, even for 5 or 10 minutes, early morning or late evening, okay. So vitamin D can be made at that time. Okay, so this is, so what we say, sun protection between 10 to 4. Okay, this is the harmful of sun, like sun exposure there. But if it's early morning or late evening, if you just expose your skin for 5 to 10 minutes, then your skin can make vitamin D. So there's nothing as such. And even at that time, we don't want to expose our skin between in the afternoon.
Right. And doctor, many people ask because sunscreen is something that we need to use for the longest time, maybe throughout our life. Now, is it safe to use a sunscreen that often, that regularly, or could it be toxic?
Yes, there are some skin allergies which have been seen because of sunscreen. So if it happens, then we change the formulation. Okay. And now the sunscreen which are available, they are all being safe so that you can wear it for a longer time. And when I talk about physical sunscreen, I said they are really they don't absorb the UV rays, they reflect the UV rays. So basically, they are just like they make a layer on the skin. Okay, they're not being absorbed by the skin, so they are very, very safe. So that's why there are these broad spectrum sunscreen are there, and they are quite safe to use for a long time.
Fair enough. And doctor, why not just cover up with clothing instead of using sunscreen? Many people do that. They'll just put a scarf or hat or something, and they won't use sunscreen. Please elaborate on that.
No, you're correct. Sometimes what I said to my patient that if you're wearing a sunscreen, okay, and even though you go out, I always them to wear a hat, because sunscreen, I said, it's protecting, okay, to certain extent, not 100% protection. Okay, it has a limit and for some hours. But if you are out for a long time, even wear a hat or wear a mask, because that extra protection it will be. Okay, so wearing sunscreen is very important because, as I said, if it has been absorbed, we are wearing a hat, but anyway, the sun is there from the side, right? And we are just discussing about premature aging or, sunburn, even that. And then also there are some, which I said, it decreases your skin immunity as well to a certain extent if you're exposed to harsh and for a long time. So obviously wearing a sunscreen is very important in any ways. Okay. So that is there. And then, of course, if you are putting extra protection, that is more like you're putting more extra protection. It's good.
Exactly. So no excuse or going out from sunscreen. You need to use sunscreen regularly, daily, reapplication, right amount to apply. All is important. And in addition to that, you can put hat or cap or some clothing to safeguard your skin. Now doctor, many times there are people who sweat a lot. So the moment they'll apply the sunscreen, they'll sweat it out. Or there are people who are like athletes who run, sweat, and definitely the sunscreen goes away. Or swimmers, because they are underwater and there they get really tanned and all. How to prevent all this?
So I mentioned about water resistant sunscreen.
Mhm.
So those sunscreen has been already tested that in a water they'll stay for 4 to 6 hours, and then you have to apply it. Okay, reapply. So we all usually prescribe those water resistant sunscreen to our patient when it's come to swimming. When in sports that we're sweating a lot, then there is like you have to oftenly apply it. For example, in 2 or 3 hourly, in that case, you have to oftenly apply the sunscreen. Though they say sweat resistant sunscreen, but I usually see that they actually drip down when you sweat out. So that dripping down means that you have to clear it and you have to reapply. So that is the factor you have to put. So we have to apply it for us, instead of 6 hours, it should be 3 hours. We have to apply.
Right, right. Okay, Radhika Ajit is here asking, ma'am, is any sunscreen good for my 6-month-old baby?
No, I don't prefer. No, you don't need. No,
Mhm.
it's not. Below 2 years, so definitely not. I think. And because the
Okay,
safety level has not been
right.
proved yet.
Okay. And doctor, what else should we know about sunscreen and what else can we do to protect ourselves from the sun or other, radiations or lights? What can we do apart from using sunscreen? Anything there?
So what I know about it is like for laptop now there are some blue light
Screens, yeah, protection
screens are
screens
there.
are there, right?
You can use those, and so that is the thing. Then of course use less laptop when you're not possible, like for you. Okay, give some time to yourself.
Mhm.
And whenever you go out, make it ensure that if you really want to go for a walk or something, do it at the late evening or early morning. Okay, that
Mhm.
is best way to get do any sort of outdoor activities. So this is what I think is best.
Right. And Pramod is here asking, what is vitamin C and how does it add to my skincare routine? Though we are not talking about,
Yeah.
but still, if you would like to, add something
And
to
so
that.
vitamin C has different formulations available in the market, okay, and they are known as stabilized form of vitamin C. And so when you apply vitamin C, it actually helps in pigmentation reduction, okay, it regulates the tiredness enzyme, as
Mhm.
well as it is considered as a collagen booster. Okay, it's boost the collagen, so as it helps in premature aging. So it gives better collagen building. So this is how vitamin C serum is applying, and also it gives light glow on your face because your pigmentation goes down. Your tanning also being taken care of. So now they
Mhm.
have sunscreen with vitamin C. Okay, so as I
Right.
mentioned, so that it's really helpful for you. So these are the stabilized form of vitamin C, which is available. If you apply on the skin, it's really been absorbed and it will help you a lot.
Okay. And then we have, makeup products or moisturizers, etc., with sunscreen.
Yeah.
Now, my question is, because many a times people will use that like face powder maybe with sunscreen protection or a moisturizer with sunscreen protection and ask that, is it fine or do I need a standalone sunscreen? What's your take on that, doctor?
So as I mentioned, like there are, as you like SPF 15. What I can see in makeup, what is available to my knowledge is SPF 15. I've seen it till now.
Right. Mhm.
So SPF 15, if you're using just as a makeup, it is okay. But if you're doing some procedure, I usually tell them you can put first the sunscreen and then your makeup sunscreen with SPF. Okay, so that gives a better protection. Okay, so yeah. So if you
Right.
can really do that, that is really more better protection than just putting the sunscreen and the makeup, right? And sometimes the patient might complain that it makes your skin, too much of a layer. then if that is a concern, I tell them omit your moisturizer, because the sunscreen now they have that moisturizing effect as well. Wash your face, apply sunscreen as a first layer, and then your makeup with sunscreen. That's how you can change
Right.
your routine.
Right. And before we wind up, Doctor, any take home message for our viewers?
Yes, so the take home message is sunscreen is a must, whether you're indoor or outdoor. Okay, and yes, even if you are putting a sunscreen and, as you asked, wearing a hat or a scarf or a full sleeves t-shirts will definitely is an add-on to it. So wearing a sunscreen is a must, even if you are wearing any sort of cap or a sunscreen or a t-shirt. Okay,
So no way out, no excuse for not using sunscreen.
if
You
you want
need
to
to use
prevent
sunscreen.
If you want to prevent premature aging, you want to delay your pigmentation, then sunscreen is an important routine for our lifestyle. I should say that.
Thank you so very much, Dr. Chanchal, for your valuable time, ma'am. It has been a very informative session for our viewers. It was great hearing you. Thank you so very much.
Thank you. Thanks a lot.
And we really look forward for many such sessions for our viewers in the coming times. So thank you once again. And viewers, thank you for your participation in today's session. Stay connected to our beautiful Spotless Skin page. Thank you. Have a great day ahead. Goodbye.